Why does the right kidney sit lower in the abdomen than the left? And what is the exact front to back sequence of structures entering the renal hilum? So this is an important question. Why is the right kidney sits lower in the abdomen than the left kidney? Okay, so welcome back to my YouTube channel on Sagacious Learner. So today we're going to start with the anatomy of the kidney. It's a very important topic. So what are you going to learn at the end of this lecture? You're going to understand, or we're going to start with the introduction and functions. There are 6 main core functions of the kidney. So you're going to know about the functions. We're going to talk about the position and the borders of the kidney. We're going to discuss about the renal hilum of the kidney, then the 4 anatomical coverings of the kidney. We go ahead and talk about the cortex and the medulla. Then we describe the collecting system. Then we move ahead to discuss about the anterior and posterior relations of the liver of the kidney. Then we talk about the arterial tree and the venous drainage. Then we talk about the nephron and the microvasculature of the nephron. Talk about the lymphatics and the innervation. Then we talk about the clinical pathologies and intervention. So first of all, what is the kidney? If they ask you to introduce or to define the kidney is a bean-shaped pear organ which is bilateral, meaning that they are bean-shaped. They have a bean-shaped structure and they are located in the posterior abdominal wall. So what is the main functions of the kidney? The main functions of the kidney is to filter liters of blood, like the filters blood and excretes excess water from the body. So there are 6 major functions of the kidney. So what is the first one? The first major of the functions of the kidney is excretion. So what are we excreting? We are removing waste metabolic products. So the metabolic waste products is what we are removing, such as creatinine, those wastes from uric acid, all those things that are not needed by the body. So the another thing the kidney do is electrolyte balance and water control. So the kidney is responsible for excretion or to regulate the amount of water in the body, and it also helps in electrolyte level. How? Example, we have sodium, we have calcium. So depending on the amount of the electrolyte the body wants, the kidney will filtrate the electrolytes from the blood, then reabsorb these electrolytes depending on the amount of the electrolytes needed by the body. So another thing is acid-base balance. So the kidney helps or functions in acid-base balance. How? The kidney excretes excess hydrogen ion in order to reduce the acid of the body, and it reabsorbs these bicarbonates in order to maintain the base of the body. So the kidney helps in acid-base balance by maintaining the blood pH for around 7.35 to 7.45. So another functions of the kidney is the maintenance of the red blood cell. They stimulate the formation of the red blood cell. How? By forming erythropoietin. They produce erythropoietin, and this erythropoietin is responsible for the formation of the red blood cell. So another function of the kidney is the blood pressure. They regulate blood pressure. How? By producing enzyme called renin, and this renin functions through renin angiotensin aldosterone system. That is how this renin function. And what is the end product of this renin? This renin is now converted to aldosterone, and this aldosterone is help to reabsorb water in order to increase the blood pressure. So we have vitamin D. The renin also helps to convert inactive vitamin D to its active form, also called the calcitriol. And this calcitriol perform a very important function in making the bone strong. So they help to nurture the bone and make it stronger. So these are the 6 main functions of the kidney. So let's talk about the location of the kidney. The kidney is located in the posterior abdominal wall, and the size of a kidney is a size of a fist. So the kidney is approximately a size of a fist or a clenched fist. So the main function of the kidney is what? To filter the blood and to eliminate nitrogen or nitrogenous waste products. So we have the properties of the kidney. So what is the first thing about the properties of the kidney? It is reddish brown. The kidney is reddish brown and it is retroperitoneal. So if you hear about retroperitoneal, what comes into your mind? Retroperitoneal just means it is outside the peritoneum. So the kidney is largely covered by a costal margin. So costal margin we are talking about here is the ribs. So the ribs surrounds and cover the kidney. The main function of this rib is to protect the kidney. So what is the movement or the mobility of the kidney? The kidney is moved by the construction of the diaphragm. So when the diaphragm constructs, the kidney moves to about 2.5 centimeters. So let's talk about the borders of the kidney. So we have the lateral border and we have the medial border. And the lateral border is convex together with the medial border. The medial border is also what? Convex. So the borders of the kidney are convex. So what is the most important thing about the kidney? Is the right kidney is slightly lower than the left kidney. Why? Right kidney allows for the accommodation of the liver. So the left kidney is found at the left rib, while the right kidney is found at the intercostal space between the left and the 12th rib. And don't forget that the left kidney is slightly higher than the right kidney due to the accommodation of the liver in the right side of the abdomen or in the hypochondrial region. So let's talk about the renal hilum. So what are the renal hilum? Anything called hilum is place where lympho-neurovascular structures enters and leave. So when you hear renal, it is related to the kidney. So the renal hilum is where lympho-neurovascular structures enters and leave the kidney. And what are the main major structures you are going to find in the renal hilum? So I call this the value, which is VAUA. So this means the first things you are going to find there is the renal vein. So another thing you are going to find there is the branch of the renal artery. Remember, VAUA. So V there stands for the vein, means renal vein. A stands for the branches of the renal artery. U stands for the ureter or the pelvis ureter. Then A stands for what? The accessory renal artery. The renal vein, the renal artery, the ureter, and the accessory renal artery. So we have the renal sinus. The renal sinus is a large cavity that extends inward from the hilum. So this is the renal sinus, and this renal sinus is an extension of the renal hilum. So we have coverings of the kidney. So we have 4 major coverings of the kidney, and the first one is the fibrous capsule. So what does the fibrous capsule do? They are the tissue surrounding the kidney. First, we have the fibrous capsule. The fibrous capsule surrounds the kidney. The second thing is the perirenal fat. The perirenal fat surrounds the fibrous capsule. The third thing is the renal fascia. The renal fascia surrounds both the kidneys and the suprarenal gland. And the third thing is now the pararenals or the pararenal fats. So what does it do? It lies external to the renal fascia, forming the part of the retroperitoneal fat. So in just straight to the point, the pararenal fascia just covers the whole fascia surrounding the kidney. So the important thing we are going to talk about is now the anatomical structures of the kidney. So the first thing we have in the anatomical structures of the kidney is the renal cortex. So the renal cortex is the outermost region of the kidney. So we have the renal medulla. The renal medulla is the inner region, while the renal cortex is the outer region. And the renal medulla is made up to 11 shaped renal pyramids. It varies based on individual. And we have the renal pyramids. So for the renal pyramids, we have the base and we have the apex. So the base is related to the renal cortex, while the apex is directed medially. So this is the renal medulla and this is the renal cortex. So the renal medulla, this is the base, and the base is directed outwards towards the cortex, and the apex is now related to the minor calyx, or penetrates to enter into the minor calyx, and this region is called the minor calyx. Now we have the renal columns. So what are the renal columns? Extension of the cortex projecting into the medulla between the adjacent pyramids. So this is the cortex. Remember, these structures here are the cortex, and the renal columns now penetrates between these two pyramids. Between these two pyramids, these two pyramids are now called the renal columns. So we have the medullary rays. What are medullary rays? From the name rays, what should come into your mind? Lines, striations that extend from the basis of the renal pyramids outwards into the cortex. So these are the medullary rays. These medullary rays are just striations. So we have the architecture of the collecting system. So let's talk about the collecting system of the kidney. So the first thing we have in the collecting structure or the collecting system of the kidney is the renal papilla. So from the renal papilla, and where is the renal papilla? The renal papilla is the apex. Remember, we have the pyramid, and in this pyramid we have the base, and this is the base directed towards the renal cortex. We now have the renal papilla, also known as the apex, which penetrates towards the minor calyx. Now from the minor calyx now form the major calyx. From the major calyx, we now drains this urine into the renal pelvis. Now from the renal pelvis, we now take it into the ureter. So don't forget that from the pyramid, we have the base and we have the apex. The apex is also called the renal papilla. The renal papilla towards the minor calyx. From the minor calyx, we now drain it to the major calyx. From the major calyx, we now drain it into the renal pelvis. From the renal pelvis down to the ureter. So let's talk about the posterior relations of the kidney. So we have the bones and we have the pleura. So for the pleura, let's talk about the costodiaphragmatic pleura recess. So we have the costodiaphragmatic pleura recess. So what are pleura? Pleura are layers that covers the lungs. So this pleura folds, or they change its name as it passes from one region to another regions of the lungs. So we have the costal pleura and we have the diaphragmatic pleura. So the costal pleura continues towards the diaphragmatic region. So that's why we call it costal diaphragmatic pleura recess. There is an area, and inside that area, this region allows the lungs to enter into, the lungs just enter into these recesses during respiration. That is just the main thing you have to know. So you have the muscles related to the posterior region. So what are the muscles? We have the diaphragm. Don't never forget that the diaphragm is a muscle. And we have the psoas major. Now this is the psoas major. And we have the quadratus lumborum. Quadratus lumborum. Then we now have the transversus abdominis. So the transversus abdominis is part of the anterior muscles of the anterior abdominal region. Don't forget that. And we also have the nerves. We have the subcostal nerve, we have the iliohypogastric nerve, and we have the ilioinguinal nerve. Then let's talk about relations of the kidney. So we have the right and we have the left relations. So they are like opposites, but they have similar things in common. So the main common things there is the suprarenal glands. So for the right kidney, from the name right kidney, what do we have? We have the suprarenal gland. And what are the suprarenal gland? These are glands on top of the kidney. That is just the major information you have to know about the renal gland. And for the right kidney, we have the right suprarenal gland, and for the left kidney, we have the left suprarenal gland. So which other relations? Remember, we said the left kidney is higher than the right kidney. Why? For the accommodation of the liver. So due to that reason, we now said the right kidney is related to the liver, while the left kidney is related to the stomach. Why? The left kidney is found at that region where the stomach, where you can see the stomach, which is the epigastric and the left hypochondral region. So we have the kidney is also related to the second part of the duodenum, which is the descending part of the duodenum, which extend or descend vertically, that, or the second part of the duodenum, which is for the right kidney. While for the left kidney, there are many major organs which are found in the left hypochondral region. So if you cannot remember the relationship of the left kidney, just remember the organs found in the left hypochondral region. So what are the organs found here? We have the tail of the pancreas, we have the spleen, and we also have part of the stomach. All these organs are found in the left hypochondral region. So if they ask you to write on the organs that is related to the left kidney, just try to remember those organs that are found in the left hypochondral region. So let's talk about the flexures. So from the name flexures, we have the right colic flexure and we have the left colic flexure. So the right colic flexure, because of it is the right kidney, therefore it is related to the right colic flexure, or we also call it what? The hepatic flexure, or the right hepatic flexure. And also they have the left colic flexure. Due to this left colic flexure is related to the spleen, we now call it what? The splenic flexure, or the left splenic flexure. So this is the basic information you have to have about the relations of the kidney. So let's talk about the arterial supply of the kidney. So the arterial supply, the main major thing you have to know is just the renal artery. The renal artery, from the name renals, is related to the kidney. So artery there is artery. So we have the renal artery. Then if you now want to describe how this artery now supplies the kidney, in case if you are asked, that's what I'm going to do. But in exam, in MBBS exam, just write renal artery. That is what is required. So for the rundown, we have the aorta. The aorta divides to form the renal artery. Now this renal artery subdivide to form the segmental arteries. You know, in the liver, in the kidney, we have segments. So due to this reason, we now call it what? Segmental arteries. From the segments, we now have the lobar arteries. The lobar arteries now further divide to form the interlobar arteries. The interlobar arteries now further divide to form the arcuate arteries, and the arcuate arteries now further divide to form the interlobular arteries, and these interlobular arteries now further divide to form the afferent glomerular arteries. So from the afferent glomerular arteries, we now supply the glomerulus, and this glomerulus is like a capillary in the bone marrow capsules, and inside these bone marrow capsules, like where we find these bone marrow capsules, is the nephron. And what is the nephron? The nephron is the functional unit of the kidney. So let's talk about the nephron. So first thing you have to know about the nephron is the functional unit of the kidney, and we have two capillaries in the nephron. We have the glomerulus and we have the peritubular capillary bed. So the main thing you have to know about the glomerulus is just it is a capillary which is found in the bone marrow capsule, and it is supplied by the afferent arterioles, and it is not drained by the efferent arterioles. So you have the peritubular capillary bed. So the peritubular capillary bed, the main major thing you have to know is it is supplied by the efferent arterioles. So let's talk about the venous drainage, the lymphatic, and the innervations. So the venous drainage just follow the opposite of the arterial supply, which is the interlobar veins, the arcuate veins, the interlobar veins, the renal veins, then to the inferior vena cava. So let's talk about the lymphatic drainage. Since the kidney is related to the ribs or close to the lumbar region, it is not drained by the what? By the lumbar lymph node. You see, that lumbar, because it is related to the lumbar or the ribs. So due to this reason, we now call it what? Lumbar lymph node drains the kidney. So what are the innervations? So the innervation of the kidney is renal sympathetic plexus. So if you cannot remember anything, just write for them renal plexus. You're also correct. So just write renal plexus or renal sympathetic plexus is like that is the main thing you have to know. So I think I've done justice to that. So let's discuss the last most important thing of the kidney, which is the clinical applications of the kidney or the clinical anomaly of the kidney. So the first thing is we have the chronic kidney disease. So we have two types of disease in this chronic. We prefer calling this chronic disease the chronic renal failure. And this chronic renal failure is how you call it. So first, let's make it simple. We have chronic and we have acute. So chronic means it occurs gradually and it lasts for a very, very, very long time. Sometimes it can become irreversible. So we have the acute renal failure. The acute renal failure is something that just happens sudden. It is short. So when you search the meaning of acute means sudden. It happens immediately. And sometimes it is reversible, meaning that something can be done. You get? So let's just define the chronic kidney disease, also refers as the chronic renal failure. So the major thing is whenever we have high creatinine in the blood, we term it what? Chronic kidney disease. Now we have what we call creatinine. What is creatinine? Creatinine is like a metabolic waste product which is usually found in amino acids. So they are just have it in mind, they are just waste products, metabolic waste products, which is excreted together with the urine. But when this creatinine is found in the blood, or when the concentration is high in the blood, that means something should start coming into your mind, which is the glomerular filtration rate is not working. It is failing. Because this glomerular filtration rate is responsible for filtering out this creatinine to maintain this creatinine level in the blood to be normal or low. But since it is high, it simply means that this GFR is not working. So what should come into your mind is what? Chronic kidney disease. And another thing that should also come into your mind in this chronic kidney disease is there is usually presence of amino acid, or let's make it simple, there is usually presence of what? Protein. So you see protein in urine. So when there is protein in urine, it is abnormal, usually albumin. It is an abnormal factor which is present in urine. So when this is happening, that means your GFR is not working, which simply means therefore there will be what? High creatinine, and this is chronic kidney disease. So you have to do something. Just have it in mind. Chronic kidney disease is when the GFR is not working, is failing, or the presence of what? Protein in urine or in urinalysis. So I think this is all we have. Don't forget to like, subscribe, and hit the notification bell for more videos like this on Calyces. I hope you enjoyed this video, and make sure you write it like this in exam whenever it's called for.